Welcome to the first module on the Fibromyalgia Online Self-Management Education Program. This is Yeliz Praya. On this module, I will be providing you with a brief introduction to fibromyalgia, discussing which symptoms are commonly reported, how is it diagnosed, theories behind causation, meaning why do we get it, distribution in populations, so how common is it, risk factors to identify the likelihood of getting fibromyalgia, prognosis, and finally, the recommended guidelines for the condition management, with specific focus on self-management in the long term. Fibromyalgia, also known as fibromyalgia syndrome, is a complex, multidimensional, chronic widespread pain condition associated with distressing symptoms of fatigue, sleep disturbances, cognition problems, and depression, among other symptoms. Our understanding of fibromyalgia has rapidly undergone evolution, especially over the past 2 decades, with various changes in symptom domain to define the condition. Historically, Sir William Gowers was the first to describe diffuse chronic musculoskeletal pain condition as fibrositis, the inflammation of the fibrous tissue, back in 1904. Prior to that, muscular rheumatism was used to describe chronic pain that is not originating from the joints. Fibrositis was a term used to describe chronic muscular widespread pain until 1976, when symptoms of chronic muscular widespread pain were coined fibromyalgia by Hange. Nevertheless, the focus on muscular involvement in pain was changed following biopsy studies conducted, as these proved that muscle is not the source of pain in people with fibromyalgia. Nevertheless, the term fibromyalgia stuck. Subsequent studies demonstrated the role of the central nervous system as possible source of pain. Since then, extensive research have aided in shaping the understanding of the condition from a typical muscular pain condition to a broader systematic condition, which we will explore through this online program. Other symptoms in fibromyalgia are swollen tissues, numbness and tingling in upper and lower limbs, often without the objective evidence, chronic headaches, chest pain, shortness of breath, and palpitations, gastrointestinal symptoms such as nausea, vomiting, bloating, abdominal pain, diarrhea, and constipation, as seen in IBS, irritable bowel syndrome, urogynecological symptoms including urgency, frequency, incontinence, pelvic pain, and painful periods in women are also common. In terms of diagnosis of fibromyalgia, due to an unreliable biomarker such as blood tests to diagnose fibromyalgia, the process of diagnosis is complicated by various classifications and diagnostic criteria used both in between and within country medical practitioners. The American College of Rheumatology, ACR, were the first to develop a diagnostic criterion for fibromyalgia, which also have been revised in 2010 from the original criterion developed in the 90s. Virtually, patients undergo a tedious process of medical screening to rule out other potential diseases before obtaining a diagnosis. These uncertainties in diagnostic criteria have triggered debates on the legitimacy and lack of confidence in the diagnostic criteria, especially in the primary healthcare settings. The revised 2010 ACR criteria recommends patients satisfy diagnostic criteria for fibromyalgia if the following 3 conditions are met. These are widespread pain index, which is a self-reported questionnaire, greater than or equal to 7, and symptom severity scale, again self-reported, greater than or equal to 5, or widespread pain index 3 to 6, and symptom severity scale greater than or equal to 9. Second, the symptoms have been present at a similar level for at least 3 months. And thirdly, the patient doesn't have a disorder that would otherwise explain the pain. In terms of pain mechanisms in fibromyalgia, this is still a subject of debate amongst researchers and clinicians. Chronic widespread pain is the hallmark symptom of fibromyalgia, and several authors have argued that pain perception is predominantly driven by the central nervous system involvement, while other authors argued that pain perception is instead originating from the periphery, such as our limbs. Due to complex nature of the pain mechanisms in fibromyalgia, we have dedicated a specific module to this, Module 2, which will explore pain mechanisms and management in detail. The exact cause of fibromyalgia is unknown, but is thought to be related to abnormal levels of certain chemicals in the brain and changes in the way the central nervous system, the brain, spinal cord, and nerves processes pain messages carried around the body. Therefore, the central sensitization theory is considered as the principal mechanism responsible for increased pain severity in fibromyalgia. The term central sensitization syndrome is thought to have other mechanisms also. These are things like psychosocial mechanisms relating to the interrelation of social factors and individuals' thought and behavior. Psychosomatic symptoms, again relating to the interaction of person's mind and body. And other chronic pain conditions such as rheumatoid arthritis and osteoarthritis that commonly co-occur alongside fibromyalgia are also thought to be associated with central sensitization. It's also suggested that some people are more likely to develop fibromyalgia because of genes inherited from their parents. However, research to support this is still in its infancy. Studies are continuing to explore the possibility of genetic involvement in the etiology of fibromyalgia, as other researchers argued that pain is not associated with genes, but rather other symptoms of fibromyalgia, like depression, anxiety, was shown to be related to genetic factors that are regulated by same physiological factors. Therefore, it is still unclear how genetic factors influence the etiology of fibromyalgia, judging from the contrasting findings. Given the variability of hypotheses in genetic studies and wide range of confounding factors, it is difficult to ascertain the extent of genetic predisposition in fibromyalgia. In many cases, the condition appears to be triggered by a physically or emotionally stressful event, such as an injury or infection, giving birth, having an operation, the breakdown of a relationship, or the death of a loved one. It is difficult to estimate the true prevalence of fibromyalgia due to the wide varieties in how this condition is diagnosed and classified across different populations. However, the crude estimation of this in developed countries such as the UK is about 5%, around 1 in 20 people. Anyone can develop fibromyalgia at any age, but the current estimates suggest that it is mostly reported by women, which may be due to diagnostic bias or health-seeking behavior. There is also no known racial predilection, but it is common amongst the people with other rheumatic and musculoskeletal diseases such as rheumatoid arthritis and lupus. Looking at the risk factors in fibromyalgia, we can summarize this such as age. So fibromyalgia can affect people of all ages, including children, but most people are diagnosed during middle age, and you are more likely to have fibromyalgia as you get older. Again, lupus and rheumatoid arthritis, as discussed before, you are more likely to develop fibromyalgia if you have such painful rheumatic conditions. And some other factors have been weakly associated with onset of fibromyalgia, but more research is needed to see if they are real. These possible risk factors include sex, or gender. We know that women are more likely to have fibromyalgia than men. Stressful or traumatic events such as PTSD, repetitive injuries on a joint, such as frequent knee bending, that can happen in certain occupations, illnesses, for example, viral infections, family history, and obesity amongst these. In terms of prognosis, fibromyalgia is neither progressive nor fatal, so that is the good news. However, we know that fibromyalgia can cause pain, participation restriction, and lower quality of life, and may lead to complications such as more hospitalizations and higher rates of depression. So therefore, screening and early treatment of depression is extremely important in symptom management of fibromyalgia, as mood disorders can impact pain and fatigue and participating in social activities as well. So treatment can significantly improve symptoms, function, and quality of life. There's lots of studies to report this. Complete recovery is rare, and there is no simple cure, but remission is possible. Studies shown positive attitude and effective coping strategies are highly associated with good treatment outcomes. Regular physical exercise, which is maintained in the long term, can result in significant reductions in pain, fatigue, and sleep problems. In terms of barriers to improvement, as in most other chronic conditions, poor emotional health, long-term stress, excessive self-medication, excessive alcohol and drug use, smoking, excessive caffeine use, sedentary lifestyles, and obesity are all associated with worse treatment outcomes. As there is no single known to be effective pharmacological treatment for the management of fibromyalgia, clinical guidelines recommend non-pharmacological therapies to be the first point of call in treatment. These were shown in the guidelines to have a more significant impact on the quality of life, clinical manifestations, and symptoms compared to pharmacological interventions. So it's important to get physically active. Experts recommend that adults should be moderately physically active for 30 minutes a day, at least 5 days a week. So you could walk, swim, or bike 30 minutes a day. And these 30 minutes can be broken into 3 separate 10-minute sessions during the day in order to pace yourself and cope better with these activities. And of course, we all know that regular physical activity can also reduce the risk of developing other chronic diseases such as heart disease, diabetes, and obesity. If you are struggling to cope with your symptoms, you should contact your GP to explore your options for medical management, such as prescription of antidepressants and painkillers, which may help with chronic headaches or back pain that may perhaps stop you from undertaking such activities. The management also includes talking therapies, such as cognitive behavioral therapy, which we call CBT, and counseling is shown to be effective in management of fibromyalgia. So if you are struggling from mood disorders or coping with stress or anxiety, please contact your GP to discuss your needs. Lifestyle changes such as exercise programs and relaxation techniques can also lead to positive treatment outcomes and do not have any side effects. This is why this online program is supported by a variety of resources to access such self-management strategies. There may be community pain management group education programs available in your area. Again, please explore this with your GP. To summarize the management of fibromyalgia, we need a combination of pharmacological and non-pharmacological, such as therapy and education, interventions for the long-term management of your symptoms. Your GP plays an important role in helping you to manage the impact of fibromyalgia. So please do not hesitate to discuss treatment options with your GP. In this online program, each module visits a specific topic such as pain and fatigue to help you develop a thorough understanding of the cause and management strategies for such symptoms. As you become more informed, we hope that you'll be able to better cope with the impact of fibromyalgia in your daily life. In your online self-management pack, you should have SMART goal setting sheet, weekly physical activity log, and weekly activity diary, which you can download as PDFs and complete it at home. So your homework is to have a go at completing these and review your activities and goals each week to revisit these to revise according to your changing needs. On the right-hand side of the FAME online program webpage, you will have access to physical exercise sheets also to download and practice at home. At the bottom of the webpage, there are also some useful links to online exercise videos, which you can follow at your own pace if that's what you prefer. And we recommend you to start slowly and practice this daily to receive full benefits. Of course, remember to pace yourself. Always respect what your body is telling you, so don't overdo it. We also highly recommend you to practice daily relaxation to suit your lifestyle. We have provided you with a brief introductory video to mindfulness, useful links to online mindfulness resources, and guided meditation on the FAME online program webpage. However, you can also practice mindfulness in silence or when walking outdoors, taking your time in the garden to smell the roses. The aim is to make time for yourself to stop and stare and take time out from daily stress and worries to focus on your health and well-being. Thank you for listening. You now have completed the Module 1 Introduction to Fibromyalgia. We hope that you have enjoyed this brief introduction and feel better informed about your condition. There are countless resources out there online to explore this topic further according to your learning needs. Please see useful links for more information. Next module, the Module 2, Pain Management, will provide you with more information on the mechanisms which drive pain sensation in fibromyalgia and how best to manage chronic widespread pain in the long term. You can access to the next module whenever you are ready.